Okay, so before the stream and everything starts, I'll just specify that I've kept three tabs open here. One is my good notes, first aid, my OBG notes, which is the subject that I'm going to do before, and lastly, just this stream session. So let's start. I'll be reviewing. Okay, you guys can do it along with me, and I'll keep this session less of no forest sessions for this one. Okay, it'll be more of a casual session. One is my good notes. So it'll be more of a casual session, and I'll be seeing all your messages on the chat screen, and I'll be replying to them as well. So, like on my phone. So, okay, let's start. Okay, so first is why did I get this wrong? Obstetrician performs. I'll be doing gynae questions first. Okay, so gynae questions first. All right. Okay, so I'll be reviewing gynae incorrects first, and let's see. Uh, this is an obstetrician performs aspiration. Okay, and what is this? An obstetrician performs aspiration of the endometrial cavity. Okay, in a woman who complains of missed periods. Okay, यहाँ पे they are like missed periods 2 weeks back, which are the following. So I was thinking I actually could decipher that this is the Carmen's cannula, and I thought, missed periods. Acha, look at such a big blunder. I mean, such a big blunder. I mean, this is I can't believe the biggest. I mean, I made such a big blunder. Um, this is very sad. I mean, like literally, मतलब इससे बड़ा सिली मिस्टेक और क्या हो सकता है? मैंने ये मिस्ड पीरियड्स के लिए आई है. Okay, so they haven't said dead fetus or something like that, right? So obviously it is not going to be this thing. I mean, it will not be suction evacuation. Suction evacuation to तब होता ना जब you would have had some kind of remnant conceptus inside the uterus. तब suction evacuation होता. I'm so stupid. अच्छा जो भी है silly mistake. तो silly mistake अगर है, I think I'll just question mark it because usually my yellows are for silly mistakes in past years. So this is something that I want to practice again. I mean, question marked, silly mistake, okay. This is really bad. So silly mistake. Let's see. So suction evacuation, okay. So the answer is menstrual regulation because obvious you have this missed periods 2 weeks back. Okay, missed periods 2 weeks back, and there is no mention of conceptus or anything, and she's not even an old lady ki endometrial ablation you have to do, and dilatation curettage also is not there. So here the instrument is Carmen's cannula, very good. That is so okay, and what else? Menstrual regulation is the menstrual regulation aspiration of the endo within 14 days of a missed period in a woman with previous normal. So okay, and under aseptic precaution, the cervix gently dilated using 4 to 5 millimeter size dilators. Okay. Okay, let's quickly. I'll just read this, and I think, I'll switch over between reading and analyzing the question. I'll mute myself for now and just get in, like, do this question quickly. Okay, so if anyone around had a query that, I'm very skeptical about the thing that matlab, why are they aspirating the endometrial cavity within 14 days of a missed period? To within means like why are they doing this, and how does it help in menstrual regulation? See, this is very obvious that any kind of invasive procedure, or like this thing, the natural orifice invasive procedure will be contraindicated in advanced pregnancy and local pelvic inflammation, because it basically would increase the inflammation. So that's obvious. And that brings me to this thing, when abortion hasn't been mentioned, so it can never be this shit. Okay, so yeah, yeah, I think I'll write this doubt, like I'll write down the doubt, and I'll ask in one of the Telegram groups. Very essential. Okay. Excuse me. I don't know how many times I've done mistake in this question. I mean, um, this is something that really bothers. I mean, every time I get this wrong. I mean, repeatedly. I've got this wrong repeatedly. So, young female, यहाँ पे severe itching they're saying, and they're saying severe itching first thing, and they're saying vulva, severe itching in the vulva, foul smelling, thin green discharge. Okay, green. So foul smelling, itching, green. Okay, and here you have examination. The cervix shows that reddish strawberry cervix. Okay, itna the thing, but then strawberry cervix, where it was completely, I forgot. Okay, and okay, there's a bunch of things, and I really feel that this is one thing that I haven't been able to master at all. So the appearance of cervix showed colony. Okay, trichomoniasis, fine. Where is the table? I mean, they didn't get the table here. Okay. I think I had the table somewhere. Gynae infections. देखते हैं यहाँ पे I have something. Okay. So I have a table. अब अच्छे से इसको देखते हैं, ठीक है? See, green discharge अगर होगा तो if you have green discharge, okay, so then it is going to be trichomoniasis. Okay, let's just pinpoint things. कि अगर green discharge होगा तो that is going to be trichomoniasis. अगर dirty white, if we get dirty white, then that is going to be bacterial vaginosis. Very important, bacterial में there is no itching. Okay, this should be highlighted with red. Okay, because this is the one that I always forget, and pruritus is present in the other two. Okay, यहाँ पे लिखने का भी जरूरत है. Okay, so and curdy candida, that is very relatable. So the moment you get green discharge, ठीक है, strawberry vagina, okay, strawberry cervix. Why have I written vagina? Okay, just inflamed vagina, inflamed cervix. Okay, it was cervix, not vagina. Okay, it was strawberry cervix. So let's see. It was not, it was cervix. Okay, so this is cervix, and pH, okay, 4.5 is zyada. Here you have more, and here you have less. Okay, and okay, so let's be very clear with this. Bacterial vaginosis, it's going to be dirty white. Okay, and there's going to be no itching. That is the most important thing. Bacterial vaginosis, no itching. If anyone has any kind of mnemonic to this, please let me know. Bacterial vaginosis, no itching. And here trichomoniasis is green, and you even have dysuria here. Okay, greenish discharge, yellowish green discharge, strawberry cervix, and the rest everything is this. So I think that should be more than enough. And bacterial vaginosis ka organisms, you can say Gardnerella, Mobiluncus, and Ureaplasma urealyticum. Fine. Okay, this after this thing, clue cells, I actually forgot this part. So maybe when in one of these days I'll be doing micro and all these things. So that's when I'll revise it. Okay. Okay, so यहाँ पे what do they have? The appearance of the cervix, obviously colpitus macularis, बस highlighted वाला पढ़ते हैं, ठीक है? Let's read just the highlighted ones. Trichomoniasis, copious, frothy, offensive. So this is also offensive. Wet mount, direct visualization. This is a weird name of a medium given. Let's look at that. I mean, insert background music. Feinberg Whittington medium. Should I write this down? Should I write down Feinberg Whittington medium in my notes? No ways. I'm not writing that down. Okay, it's best that I'll just bookmark it and say that okay, there is a lot of extra information in this. So standard treatment, metronidazole, tinidazole, that's fine. Okay, because at the end of the day, those are worms, right? And yeah, Tabi, I think. Oh, here they have written diamond medium, weird medium. Okay, so we can actually write down what was that medium's name. Okay, I'm not doing that. I mean, I think we'll never be tested on that medium ka name. And yeah, metronidazole, very important. Partner treatment is also needed. Okay, this is also like that red flag thing. Partner treatment is also needed in trichomoniasis. And metronidazole is 2 gram, start orally. 2 gram, start orally. Okay, so okay, so let's see. I think more or less it's okay. Next you have is chlamydia. Chlamydia. But did we have? No, we don't have chlamydia, so that's why this is all extra information that I have to do while doing gynae and infectious diseases. Patients presents with mucopurulent discharge, urethritis, dysuria. Okay. Oh, chlamydia at the end of the day it's bacterial vaginitis, so easily dysuria. So even if I put dysuria in the other, like in my table, where was dysuria? Dysuria was in trichomoniasis. Okay. Here also they'll have dysuria at the end of the day. Okay. Next, let's see nucleic acid amplification test. 1 gram azithromycin, doxycycline 100 milligram, inflamed cervix, mucopurulent cervical discharge, but they don't have greenish. Greenish is different. Now the question that I marked, okay, it is odorless. Gonorrhea is odorless. Okay, just remember this. Have to remember this. Gonorrhea is odorless. So only that chart is not enough. Actually have to divide all the bacteria also. This is odorless, odorless. Okay, and yellow vaginal discharge. And here is ceftriaxone and thing granuloma inguinale. This is supposed to be Klebsiella granulomatis, donovanosis. Yes, I've read this. Beefy red appearance. The ulcers has beefy red appearance. Pseudobubo. We can search for beefy red appearance, right? So later we can do it. Beefy red appearance. Pseudobubos, donovan body, safety pin appearance. Glandular cervix. Okay, so this is something that I really went through fast because I'll be doing a bit of it later on also. Okay, next question. I really had no clue about this question. So So let's go ahead and try this one. So let's say 45-year-old dysfunction uterine bleeding. Um, this gave a picture of endometrial carcinoma, but okay, so it's supposed to be metropathia hemorrhagica. Okay, so let's try and decode this. यहाँ पे they're saying dysfunction uterine bleeding, Swiss cheese pattern, endometrium, postmenopausal woman. ठीक है. Now the problem is what were the options? So common in premenopausal ये तो होगा नहीं. ठीक है. This won't be. And symmetrical uterine enlargement, this is usually in adenomyosis. Okay, it's not in this thing. And adenomyosis, that happens more in people like us. Okay, in women like us. So I don't think that also would have been the answer. I was very I don't know why I chose this weird answer. I just chose any damn thing. I was like actually under the impression that maybe because it's a postmenopausal female, so that's why something like that. But then it turned out to be this. Now let's see why it turned out to be that. So dysfunctional uterine bleeding, and I was going towards the direction of endometrial carcinoma or something like that. But okay, so that didn't turn out to be the answer. This is a completely new topic, so let me bookmark it as that. And that is not a new topic, that is more of a this thing. Okay, so let's see. Swiss cheese, histopathological in a premenopausal women. Why premenopausal? I mean 45 years? Okay, I think I'm confused as well. So premenopausal is suggestive of metropathia hemorrhagic. Okay, fine. Metropathia hemorrhagica and ovulatory abnormal uterine bleeding seen in premenopausal women. Fine. So what? I mean, post 45 years is postmenopausal. Okay, I'll remember when my mom had her menopause. So fine. Okay, that's somewhere around the age of 45. So take it. That means this is like more of a premenopausal period. So this is an ovulatory. Typical symptoms: continuous painless vaginal bleeding. Okay, so Swiss cheese pattern in histopathological study, you get metropathia hemorrhagica. So we can just look up look up this fact on this thing. So metropathia hemorrhagica, it's a massive painless bleeding. Okay, premenopausal woman. Okay, cystic glandular hyperplasia, Schroeder's disease, specialized from anovulatory abnormal uterine bleeding, premenopausal, continuous painless bleeding, 6 to 8 weeks of amenorrhea, symmetrical enlargement, change in the symmetrical enlargement. Okay, which is the following not a feature. Okay, so this also was a little bit of a reading error as well. So they are saying I couldn't diagnose only, so that's more than enough. Not a feature. So common in premenopausal, you have to think it that way. That premenopausal. See, you read it. I mean, reading errors are really terrible. Okay, so let's come back to this. So continuous vaginal bleeding. Changes here, they become symmetrical enlargement, mild degree of myelohypoplasia in the uterine wall, thin polypic cavity not required. Okay, so just the highlights. You can just go through the highlights and be done with this. And let's see, microscopy reveals Swiss cheese pattern, that is supposed to be cystic glandular hyperplasia. So we can see this, right? Cystic glandular hyperplasia. Cystic glandular hyperplasia. Cystic glandular hyperplasia. Okay, so this is how it looks. Cystic glandular hyperplasia, fine. Okay, so Swiss cheese. So I can understand from there that maybe it must have had holes or something like that. Next is absence of secretory endometrium, absence of corkscrew gland. As the bleeding is anovulatory, there is no progesterone, hence there is no secretory changes in the endometrium. Hyperplasia of the endometrial components, fine. Ovaries contain cysts that's less than 5 centimeters and necrosis. Differential diagnosis ectopic and abortion. Fine. Okay. This was completely a new topic. This was something that I keep getting mistakes in. This was a very, very silly mistake. This is somewhat of a reading error, but then I'll categorize it more towards something that I don't know. Because I was really clueless about this question and I couldn't even diagnose this. So fine. Okay, let's see this. Very sad. How could I get a copper T question wrong? So I've been out of touch with gynae for a very long time. Okay, so let's see. Which among the following statement true? First thing is true. Okay, regarding copper T. True regarding copper T. Obviously, silver is not added to the copper wire. It does not contain levonorgestrel. Fine. Now these two. I was always, more biased towards contraception is one chapter that I had skipped while doing system wise, and I think contraception, like doing contraception from PSM as well as gynae together would help more. And yeah, so this is also used as an emergency contraceptive. They're saying true, right? It has a lifespan of 10 years. Like an idiot, I actually marked this. I think it has a lifespan of 5 years or something that. I don't know. Okay, yeah, 3 to 5 years. Okay, so given image is obviously 250. It is multi-load. Okay, so that means even this is not even just copper T. It is multi-load. That means those images are also important. Okay, copper T looks like this. This looks like that. Okay, like progestin looks like this, and the multi-load looks like this. So images are important. Okay, copper T. The image is very, very important. Okay, so let's see. This is more of a, I haven't studied this topic kind of area. So it can be used for emergency contraception. Mechanism of action is obviously foreign body inflammatory changes, copper is released, enzymatic, inhibition, metabolic changes, increases uterine contractility, because of which you have expulsion of fetus eggs. Okay, and obviously, okay, and from the fallopian tube, expulsion of the fertilized egg from the fallopian tube because of all the uterine contractions, and before the development of chorionic villi, and ultimately it causes failure of implantation. Fine. So fertilized eggs, they are engulfed by macrophages, and then after it hinders the migration of sperm as well. Okay. Copper T or Paragard. Okay. So copper T has a lifespan of 10 years, and I went and marked this. Okay, 10 years. That means I mistook the image. My main problem was identifying this wrong. Okay, so I think you really have to dig deeper into the question in order to know where you're going wrong. Okay, so it's a good thing to dig deeper into the question and know where you're going wrong. Okay, so uh, let's see. Uh, okay, uh, 20. Okay, Mansi Verma. In the first INICET, the first attempt that I gave, that was in July INI. My rank was 23K. Okay, that was my first attempt. Internship. Basically, you can say internship attempt. First attempt. Okay, and yeah. So and November INI. Don't even ask me the rank. Okay, because the circumstances weren't in my favor that time. Circumstances were really not in my favor. favor. So don't ask me the rank, okay? Like don't ask me the rank of July, I mean November INI. Okay. That's great, Mansi. I think it's absolutely fine because I've actually realized this over time that means the first I gave it just after coming back, like from the hostel. I came back in April and June I prepared thoda sa, and July I gave the exam. So I think it's more like you just keep going and don't like even during my November I couldn't believe the fact that I didn't qualify. Like I was not in a position, I was not a person who could not qualify the exam. Okay, because my first attempt I got that rank, and neat also my rank was okay. So it was okay regarding the amount of time I got for preparation because I'm from a college that really had a hectic internship. Truly, I'm from NRS Kolkata. So that's like I was very devastated after INI November, and then I was like, no, I just have to get on. And then I changed my room, and I actually did a lot of changes at home. I spoke to my parents and things like that, and yeah. So I think let's get into this. I think environment makes a lot of difference, You need to have a proper environment. It's very important. Okay, like um yeah, I'm from 2015 batch. Yes, I'm from 2015 batch. Um and my internship got over in March, but I came back in April because I finished all the documentation and things like that. Lots of medical council ka work and everything, and then I came back. Came back in April, but yeah, after doing all the work, something like that. Yeah, it's great, Mansi. I'm very happy that we are in the same. I mean, we're from the same batch. So, uh, okay. So let's get. I mean, have you given this GT? How many of y'all have given this? I think means I've continuously given Marrow GTs. The best part I'll tell you about GTs. The funniest part was after I did not qualify in November. Okay, I literally went ahead and gave a GT in a separate circumstance, like just to elevate my mood. Okay, that's what मतलब किसी को सुना होगा, like have you heard anyone who gives GT just because she wants to elevate her mood? Okay, because I got more in the GT rather than my exam. So yeah, so actually I give the INI mock 2, okay, after the main INI exam. Oh, so you have given this. Okay, so let's review it together. And if you have any inputs, I'm sure you must have reviewed it. Let's. If you have any inputs, do let me know. तो देखते हैं इसको. Let's continue with the review. Okay, so let's see. इसमें I totally identified this image wrong, right? Because अगर if I clicked on this 10 years, मतलब मैंने कॉपर्टी सोच के ये मारा है एंड oh Mansi, I'll tell you. Okay, actually what happened, this is a very tragic incident. Basically, I live in an apartment, so my maid and I shared a room. Okay, my study room and my maid's room was almost the same. Okay, and she used to sleep there, and she used to go there for sleeping, and she used to sleep there basically. And then after that what happened was बहुत प्रॉब्लम होता था इन द सेंस कि like my room was literally like public kind of. मेरे पापा के files भी, my father's files were in that room. Then after that, my maid used to sleep in that room. She never used to be there when she used to come. I mean, when I used to be there. But yeah, it was little bit disturbing because her things and everything was there. So क्या है ना कि wait. So क्या है ना कि when you are preparing, okay, make sure that you have one room to yourself. Don't let anyone keep anything in that room, for God's sake. I mean, क्योंकि लोगों का आना जाना and all that, it really troubles people a lot. Okay, I felt that way. So make sure that you just have that one room only to yourself, and it can be very small. That's absolutely fine, but it has to be your room. Okay, like your own room. It can be small, no problem, but don't let anyone come in and out, and make sure they don't have their things there, because my dad had all my things there. Yeah, I actually felt better in the hostel. I can completely vouch for it. Means NRS was like my heaven. I can say that. So you're absolutely right, Mansi. I really means, coming home, and the thing is, I've lived in I've lived in hostels throughout my entire life. I'm studying in a boarding school, and it's very weird actually staying at home. So I need that kind of, my own space and isolation to study and everything. And I am preparing from home, but now actually I changed my room. My father transferred. I may be sounding like a demon right now, but yeah, that did happen, and now it's just me, my mom, and my maid. So that's a good thing. Yeah, if you have a hostel, I think like, if you have a like library nearby, like if you have a library nearby, then maybe you can do that. Like, like just nearby, if you have a library or some other place, something like that. Because but it's very essential. Like तुम्हारा, you need to have a separate room. I did not have a separate room before this. I got a separate room after my INICET November. Like I cried, I screamed, and I told my parents that मेरे को, you shift me in the other room. I don't know anything. I won't stay in this room. So you, yeah, actually, it's a very good thing. Okay, means I was blessed enough during means I was really blessed enough during my college life. मेरे seniors roommates, मैंने नज़र ना लग जाए. My seniors were great. Okay, like they used to keep quiet and go on studying. So that way I was blessed as having good seniors, and I had very good juniors also who used to actually listen to me when I used to, like, कोई मेरे room में बात तक नहीं करता था, like. But I think my seniors and juniors have been more cooperative than my own parents. Oh, that's really nice. You can totally go there and study, just for a change. Matlab, I think even if you change your chairs or change your study place, it makes a lot of difference. I have this room is entirely mine right now. Like even I sleep in this room also. So it's basically, and the best part is, like I have an attached bathroom as well. So I don't have to go out. That also helps a lot. Okay, like when you have a attached bathroom as well as the room to yourself, that helps. I mean, changing your environment helps drastically. I mean, really well. Okay, so I think I'll get back to reviewing, and I'll answer all you people ka queries at let's see 10:45. Okay, let me use it as a reward system. I'll review all these questions of gynae, and then again I'll talk to you guys. Okay, so, and in the meantime, keep telling me whether you guys have also done this. I mean, this paper was pretty decent. I found it pretty decent. The November INICET papers you guys can give. It was pretty decent. Yeah, it actually does. Your mindset, whether people around you are fighting or not, whether you have a lot of, noise at home, whether people around you are positive or not. So all of that matters. Okay, Shubhandeep Karan, I'm using 6th generation. Okay, I'm using iPad 6th generation 2018 version. Okay, that was the cheapest iPad that came in existence. I bought it in the beginning of my final year, that was in 2019. Okay, and it's still working very well, and it was the cheapest. I mean, I got the iPad as well as the pencil together during Diwali for 21,000. Okay, that was the price that time. So that was a very good deal. It is iPad 6th generation. I mean, I feel very sad when I see the prices of iPad increased now. It's really, I mean, that was the cheapest iPad in existence actually. This is Marrow, Ajay. This is Marrow. Actually, I'm reviewing a GT, so that's why it was a long, hectic day for me. You're welcome, Shovandeep. And I think, I mean, I loved using it. It's been one of my best investments till now. My this like It was cheaper than Samsung also in those days. That was the main reason why I brought it. And the interface, everything is really good. Okay, so Ajay, this is Marrow. I'm trying to review a Marrow GT. So basically, this was INICET mock, uh, November, and I gave it this Sunday. Tomorrow, I'm going to give another GT, and I have gynae to review. I have to review gynae and I have to review surgery. So those are the two parts that I have left, and I have to review it as fast as I can. So let's see. You guys put all your comments and whatever you want to ask in the comments or this thing, and let me finish this segment of gynae, and then again I'll get back to you people. It'll be like a reward. I mean, if I finish this section of gynae, this incorrect section of gynae, then I'm going to get back and answer all your questions. Um, no, I'm not going to take part in NEET counseling because the branch that I want, okay, and plus more than the branch that I want is like the college that I want, okay. It's like I'll not be getting, and it'll be additional, like an additional burden kind of a thing. So I don't want to waste my time doing that. Okay, so let's get back to the reviews. Um, See, so this is a purely, मतलब imagine इतना हम लोग silly mistakes कर सकते हैं that you identify this wrong and you mark it as copper T. Okay, copper T is 10 years lifespan, but this is an emergency contraceptive. So you guys now don't forget that it's not levonorgestrel, just वो ही contraceptive नहीं है, that mini pill. This is also contraceptive, that is multi-load 250. Okay, and it is an emergency contraceptive. So let's just read the black portions, that's it. Okay, how do you people review your GTs? Give me some suggestions. Okay, because I always tend to overdo things. Okay, all right, so let's see. um okay, so we already read this part that it was hindering the sperm motility and so on, and 3 to 5 years. This has a lifespan of 3 to 5 years, and Nova T is supposed to be the one where you have, remember this, okay? Nova means new. Maybe we can remember it like this. Nova means new. So that's why, you have this silver added to the copper wire, because Nova is new. Okay, silver added to the copper wire, fine. And copper T 380 Paragard, 10 years, great. Okay, और अच्छे से इसको देख लो. Okay, this looks like a T. That one does not look like a T, so it's not copper T. Okay, and this one is Mirena, fine. Okay, so this I'll label it as a silly mistake. इसको फिर से एक बार देखना पड़ेगा. Okay, let's see. Twin peak sign. Okay, so this is a crime. Okay, this is such a big crime. Twin Peak sign. This how could I get this? Okay, fine. Okay, so Twin Peak sign is suggestive of dichorionic pregnancy. Okay, dichorionic, fine. Okay, और यहाँ पे thick dividing membrane. Okay, and T sign. Lack of chorion extending to the T sign is T sign is the absence of the Twin Peak sign. Fine. Okay, so now we need to see a diagram. Okay, so diagram देखते हैं. Let's see if I have a good diagram around. So twins, delivery in twins. कितना सब कुछ मतलब. This is my Google, okay? These are supposed to be my notes. This is the reason why I've picked a first aid. I mean, twin मतलब मेरे को सर्च करने में भी नहीं मिलने वाला है ये. ठीक है. Monochorionic. I want to see the diagram. Okay. So I think मेरे को डाइकोरियोनिक का डायग्राम देखो. डाइकोरियोनिक. Okay. Let's look at the diagram of dichorionic. So let's take this. Monochorionic. Okay. Okay. So look at this. Okay. You will get something like this. And if you see this one, Twin Peak, that is the lambda sign. This is suggestive of dichorionic pregnancy. Fine. Okay, and there what did I mark? Okay. Yeah, very true, Mansi, very true. देखो ना मैंने the amount of silly mistakes that I have made in this paper itself. So I'm identifying multi-load as property. So it's okay. I mean, I think we need to practice more and more and more, and then after that, I think it will be better. Okay, once we complete our backlogs and complete the first revision, I'm sure things are going to be better. Okay, so देखते हैं dichorionic gestation, and there I did monochorionic and diamniotic. That's what I had marked. Monochorionic and diamniotic कभी नहीं होगा. Just look at this. I mean, this is like completely like monochorion, right? So it's going to be one chorion and that diamniotic. Okay, and यहाँ पे देखो they have a gap in between, basically to tell you that there's going to be a that lambda sign or delta sign. What was it? Okay, twin peak sign. Yeah, so twin peak, one peak, two peak. So this is the one. Okay, so that's why. Okay, dichorionic and diamniotic. And here you have monochorionic and monochorionic monoamniotic, yeah, monochorionic diamniotic. Like both you are not going to have any monos. No. So I think this is also okay. Up next ये वाला. Okay, so this question. Okay, again it's these. Okay, so these are like, I think silly mistakes, and all these mistakes, it's more about the topics that you repeatedly get wrong. I mean, sexually transmitted disease, I think every exam I keep getting it wrong because I keep forgetting the signs and symptoms. Okay, so intern person in the gynecology department who was concerned that her daughter has not achieved menarche. Fine, 14-year-old not achieved menarche. No history, breast development, secondary sexual characters, everything is normal. Now this is more of a algorithmic type of approach. So ठीक है, कोई बात नहीं. Pelvic ultrasound. I marked pelvic ultrasound and the answer was delay investigation till 16 years. Okay, 14-year-old amenorrhea, normal secondary sexual characters. So investigation has to be delayed till 16 years. Okay, so primary amenorrhea, absence of menstruation by 14 years or by 16 years. Okay, so okay, regardless of presence of secondary sexual characters. Okay, so ठीक है. So basically, अगर if you have absence of secondary sexual characters, basically you can draw, you can draw a chart here. So if there is absence, then you're going to test at 14 years, okay, and you're going to label it as primary amenorrhea. And if it is 16, I mean, if it is secondary sexual characters have come, like यहाँ पे they've already had, her breast development is okay, and she's got all other secondary sexual characters normal, so that means this is going to be 16 years, okay, so 16 years. That's why this is 16 years, and you don't do anything. You delay the investigation till 16 years. Okay. So, investigation may be delayed in girls of 14 years with the presence, that's fine. Okay. However, if they present with symptoms like Turner syndrome and so on, and there is absence, so then you can basically further investigations you do. So, this is a huge list of causes. This algorithm is very important. Okay, so even if I go into primary amenorrhea right now, let's say amenorrhea, fine. Okay, so that long list of stuff, and there was this uterus normal, this that. I think, these are very incomplete notes. I mean, I have to filter out things, and plus I have to put it there as well. I'll just mark it as this thing, and then again I'll go back. Okay, gynae I'll be doing after some days. Okay, so let's see. Primary amenorrhea, hypogonadotropic hypogonadism, fine. Hypergonadotropic hypogonadism, okay. Chromosomal abnormalities, and you have this as well. So, ठीक है, great. Oh, so this is Swayer's. Is it? Okay, Swayer's syndrome is important. Yeah, it is. Okay, absolutely. I mean, this is something. This is one of those topics that I've even seen in the old papers. This flowchart that I made was from an old paper. कि primary amenorrhea में अगर uterus normal है तो it is Turner Noonan. Uterus absent है, then you go and see the breast. अगर that is normal, then you see the axillary and the pubic hair. If that is absent, then it is androgen insensitivity, and if that is normal, then it is that Mayer-Rokitansky-Kussner-Hauser syndrome, mulatineogenesis. Yes, because actually this whole thing is very important, and I keep getting this wrong. Okay, so we delay. So the conclusion of this question is basically, since all of this is done, and that's it. Okay, let's do that. I think I will look at Swyer syndrome a bit. If I have, that is Swyer syndrome. Okay, ovarian cause. Great. This is gonadal dysgenesis. Great. Means 46XY. Okay. So Swyer syndrome, एक बार we should see, right? We can see it from here also. I mean, the best thing about digital is that you can actually search things. Swyer syndrome, since it's mentioned, someone mentioned it, I think I should just go and search for it. Okay, so I can't find it here. Okay. Anyways, we got that. And let's go to the next question. Okay, so the next question was what? 25-year-old male patient. Okay. Infertility, semen analysis. Okay, so this was also a very silly mistake. Results show sperm concentration of 18 million per ml. No agglutination is seen, morphology is normal, and 20% is the normal forms. So, okay, so here what are they trying to say? Let's see. Azoospermia तो नहीं होगा because there is some sperm. Normospermia you can't have. Okay, given semen falls to the diagnosis of asthenospermia as only 20% is present. Of the sperm is motile. Okay, so here it's more of motility. Okay, rather than the number of sperms. Okay, so 20% motile sperms. Fine. Okay, 42% it should be motile. Okay, astheno sounds so much like स्थाई हो जाना, like you have that word in Hindi, no, स्थाई. So astheno, so it is less motile, so maybe we can remember it like that. Let's see. Given semen analysis, it was asthenospermia, 20% are motile. Fine. 42%, that is like 42% is supposed to be motile, and 30% should show progressive motility. Okay, so basically the terminology, obviously यहाँ पे sperm concentration is absolutely fine. Stupid. Okay, whatever that is. Okay, azoospermia, normal sperm 16 million per ml. So this is something that needs to be written down and put in front of my face. I mean, put in front of my board basically, because this is something that we always, the values are something I think that we always tend to make mistakes in. Okay, and this was a important value based question क्योंकि infertility पे तो they are asking a lot of questions. So normospermia 16 million, oligospermia is obviously less than 15 million. Azoospermia is when there is no obviously outflow tract obstruction and all that, and here it is supposed to be 20%. I mean, here they have written it as 20%. So again we can go back to the question and see कि here they have already said that the sperm concentration is 18%, so that's absolutely fine. तो oligospermia होगा ही नहीं, so because it's 15 million. Plus you have pH 7.5, volume, all this is not, all this is distractors. No agglutination seen. Morphology come to 10% normal forms, 20% motile forms. This is where the problem lies, क्योंकि that has to be more than 42%. ठीक है, so that's what is this thing. Okay, so this is an update. And I think I'll write this down, I'll write this down and I'll stick it in front of my wall. I'll write this down immediately and come back. I'm muting myself. Okay, so let's get to the other one. Okay, so this is another very sad match the following mistake. So, oh man, this one, D and C. Okay, so D and C. 2 is D. Oh, 2. Okay, this is one thing that I think I'll complain to the Marrow people that what they do. यहाँ पे भी 1 2 3, यहाँ पे भी 1 2 3. They do never give A B C D. So whatever it is, let's see. One is supposed to be, one is A. Yeah, one is A. One is obviously Velamenchus. 2 is Battledore. Okay, so 2 is Battledore. 2 is Battledore. इसको अच्छे से देख लो. वो बैटल करने जा रहा है, दोनों साइड में इसका छड़ी है, समथिंग लाइक दैट. ओके, both sides it has so much of long whatever arms. Okay, so it's going for a battle. Okay, I'm gone mad. Okay, whatever it is. Okay, and 2 is, oh no, 2 is circumvallate. Okay, 2 is circumvallate. Okay, circumvallate because it's on the periphery. Yeah, so 2 is circumvallate. Such stupid mistakes. 2 is battle. 2 is supposed to be Battledore. Okay, 2 is Battledore. 2 is Battledore. 1 is Velamenchus. 3 is Succenturiate because you have this extra lobe, and 4 is circumvallate. Fine, 4 is circumvallate. Okay, so now I'll never forget. Battledore has this arms. Battledore has arms on the side, and circumvallate has this. Okay, so I think Velamenchus insertion of cord, that's absolutely fine. Battledore has, it's going for a battle. Okay, and Succenturiate is the presence of another small lobe, that's absolutely okay. And then you have circumvallate. So placenta extracoriolis. Okay, so placenta extracoriolis, amnion and chorion, they fold back and they form a ring inside the fetus. So yeah, I think this is a pretty good situation to be in. And okay, so gynae is done, and I think types of placenta and all this, it's not going to be that thing. Now the next, I think, wait a second, I'll just mute myself. Okay, so the next subject that I need to okay, so the next subject that I need to revise is surgery. Okay, so before that, I'll just check out you guys' messages so that, yeah, this is like a reward. I finished gynae. I finished doing gynae. Thank you so much, INICET neet-pg success. I hope you progress as well. I really hope that you progress as well. And you have gone through so much, and you're an inspiration, literally. Anonymous account, hi. Uh, Hi. Hope you're studying well. Okay. So let's see. Next, after device, surgery. So this is something that um, doesn't require effort. 6 questions, and I'll just go quickly. Strasbourg classification. Guys, put anything, whatever you want to ask, just put in the chat box. The moment I finish reviewing surgery, I'll again get back to you guys, because you are like my reward. I mean, the chat box is my reward basically for reviewing all this. Oh, congratulations, anonymous account. Okay, I'll just refer to yours first. You are gonna have the time of your life. Trust me. MBBS is the best. I mean, the best. Those are the best years. Absolutely the best years. I really, really miss my college. I mean, मेरे को तो घर आके, I mean, I came home and I was feeling sad that I had to leave college. PG के लिए don't think about PG, like don't think about PG in first year, because you need to get your basics strong. ये mistake मैंने किया था, पता है, like I made a mistake of joining DAMS in second year, and things went over my head. I hope, I wish I'll be able to make a video on this, once I get my rank, because abhi to I don't have that much of time to basically make aesthetic videos and edit and stuff like that. I'm mainly keeping this channel to keep myself consistent. First year say don't join, second year maybe don't join, okay, but I don't know what will be the scenario with you all. I would say that first year में एक्चुअली आदित्य गुप्ता एम्स, आदित्य सर का एक वीडियो है जहाँ उन्होंने नजीब के बारे में, फिर उसके बाद डॉक्टर नजीब के वीडियोस एंड पथोमा. इट इज़ एक्चुअली वेरी ट्रू. फर्स्ट ईयर में मैंने डॉक्टर नजीब के वीडियोस देखे थे, ओके, एंड दैट वाज लाइक मीन्स आई ट्राइड अंडरस्टैंडिंग द कंसेप्ट्स, ओके, एंड आई वेंट टू द डिसेक्शन हॉल. I really studied the standard books and everything. क्या है ना कि for PG you need that concise source at the end of the day. Okay, at the end of the day it's like whatever you study, मतलब MBBS का वो पूरा चीज़, whatever you're going to study, you have to distill down and do it in go for that one source. तो my only recommendation to you would be just buy first aid. ठीक है, USMLE first aid खरीदो. Okay, just buy USMLE first aid and keep turning the pages of that book, because that is like NCRT. Okay, I feel that is like NCRT. Means I'll just show you a picture of this is my first year. Like I hope you can see it on the screen. So क्या है ना कि I'll show you my own notes. Like I'll show you my derma notes for, wait a second. Suppose if I have, I'll just, so derma, okay, derma में my immunobullous disorders, my main notes are so huge. देखो, you can see this. I mean, this is like pages and pages. Okay, it's that huge. But I just summarized it in first aid, and this is just one table. One small table. This is it. इतना ही जानना है. But you won't understand this until you don't understand that wider version of it. Okay. So that's why the best thing would be एक first aid खरीदो, ठीक है, first aid. Okay. Second, go for means go for Dr. Najib's and go for clearing your concepts, and try anatomy is one of my strong points, so that's why I'll recommend that anatomy may you can get a a APK version of that visual body 3D. Okay, I'll maybe make a short on that. Okay, because apart from the cadaveric images, I mean you do the cadaver dissection, and along with that what you have these 3D models of your the human body. You can hide it, and you can fade it out and things like that, and you can do a lot of things with it. So I'll just type it in the chat box. I mean, the name of that is visual body. Wait a second. I think it was visual body 3D. And the best part is enjoy the process of, like, enjoy the process of your MBBS. That is the most primary thing that you can, the most, there's a lot to do in college. There's a lot to do, trust me. It'll grow you. I mean, you'll grow as a person. Okay. I'll just make a quick video, like I'll make a short, okay, because अभी मेरे पास बिल्कुल time नहीं है. Like the only thing that I'm doing is interacting with you guys. This is like my break, okay, because मेरे को test reviews करना बहुत exhausting लगता है. So I'll just make a short, okay. Yeah. So okay. So actually, सबसे important चीज़ है. Oh, my college, I'm from Neil Ratan Sarkar, Kolkata. Neil Ratan Sarkar Medical College, Kolkata. NRS, lovingly called NRS. So, if you go to, I mean, if you are taking up MBBS in Kolkata, trust me, that's the best thing that you can do actually. Like, if you don't mind the hectic internship, because it's a beautiful place to learn. वहाँ पे तुमको कोई नहीं बोलेगा कि you are like you are not meant to do something, That is the best part of that college. मतलब कोई मेरे को ट्रेकियोस्टमी करते वक्त ये नहीं बोला कि तुम इंटर्न हो, तुमको ट्रेकियोस्टमी नहीं करना है. So like complicated procedures like that. So I'm proud of my albumator. So yeah, I think let's keep putting your comments in the chat box, and I'll get back to you guys after I'm done with this. Okay, so after I'm done with surgery. Okay, so let's see. Okay, I'll just type it down so that. Oh, okay. So I'll be quick about that also. You have to choose between Bardhavan and Sagar Datta. Go for Sagar Datta. I mean, totally go for Sagar Datta. I mean, Sagar Datta will let you be in Calcutta. पहला बात. Okay. So तुमको अगर पीजी का कोचिंग भी करना है, so you'll stay close by. कोई कॉन्फ्रेंसेस वगैरह में भी जाना है तो you can go. If you want to join SAMHSA, go ahead and join SAMHSA. SAMHSA is a NGO that is run by doctors, and you can become a SAMHSA member and do a lot of things, okay, like workshops karna, surgical skills वगैरह, they have trauma workshops and surgical skills workshops and things like that. So वो भी कर सकते हो. And yeah, go for Sagar Datta, no doubt, because Bardhavan will become a bit periphery. Although Bardhavan में like हम लोग के एक professor he had transferred, so like just go ahead and this thing. So take Bardhaman, I mean take Sagar Datta. What? Wait, I'll remove. मतलब ये लोग spamming करने आ जाते हैं किसी को. Okay. So let's see. Let's go ahead and do surgery. Okay. And Strasbourg classification of bile duct injury. तो ये तो एकदम completely this is something like you're welcome. Okay, so let's get back to Strasbourg classification. Okay, so Strasbourg classification of bile injury. This is going to be bile leak from cystic duct, and ठीक है. So bile leak from cystic duct, and then you have minor hepatic ducts. So occlusion. Okay, so bile leak from cystic duct or from minor hepatic duct that is draining into the liver bed. Okay. Okay, referring to your comment, I think actually I have the phone right in front of me also. So that's why I'll just refer to this quickly. Sagar Datta is a great college. Okay. And they have equally good patient load. Provided that तुम patients को आरजी कर और एनआरएस में रेफर मत करना, ठीक है. So basically is going to be Strasbourg classification of bile duct injury. Okay. Okay, so let's get back. So Strasbourg classification of bile duct injury, and it is widely used for some systemic and anatomical. Okay, so here we have type 1. Okay, quickly I'll just refer to you. Sagar Datta is a great college. Okay, I have some friends there as well, and plus some of my very good seniors have actually come out from there. So it's actually a great college. Okay, compared to the fact that Bardhaman is a great college as well. Okay, it is a good college, but then the problem is that Sagar Datta being in Calcutta has a lot of those perks basically. Like it's not Calcutta proper, but then it's very close to Calcutta. So that's why it's really nice. It's an active college and good people. I don't think कोई ragging वगैरह कुछ होती भी है वहाँ पे. Okay, so let's get back to Strasbourg classification. Occlusion of biliary tree with no leaks. ठीक है. Where did I go wrong? Here. सबसे पहले तो this is one. Okay, occlusion of biliary tree with no leaks. So see, this is the problem with marrow. Here is also 1 2 3 and here is also 1 2 3. ठीक है, कोई बात नहीं. I'm just thinking that this is going to be ABCD. So 1. Okay, so I completely got it wrong. मतलब this is a completely new information for me. और ये surgery पढ़ते वक्त again when I start doing surgery I have to complete this. So A is going to be bile leak from the cystic duct and the minor hepatic ducts. Okay, so cystic ducts and the minor hepatic ducts. So here are the minor hepatic ducts and this is the cystic duct. B is going to be occlusion of the biliary tree but with no leak. So no leak is B. Take. Okay, I need a mnemonic for this. Bile leak from right aberrant hepatic duct. Right aberrant hepatic duct. Okay. So yeah, here you have an aberrant hepatic duct. Okay, means it's basically coming out this way or something like that. And this is D is for main duct. E1. So E1 is going to be injury more than 2 centimeter from the confluence. Confluence is this. So more than 2 centimeter. This is less than 2 centimeter. This is at the confluence. Confluence basically would mean where 3 things are joining. Like basically you have confluence of the river. So okay. So this is like destruction of the confluence. And here you have injury of the main bile duct. Okay, so main bile duct and aberrant right hepatic duct. Okay, alright. So let's get on. Patient is confused, opens his eyes. Oh my god, I got a GCS wrong. Okay, this is another thing which I need a mnemonic for. I'm not going to go into the details of this, but very sad. 11 and this. Okay, so this is like a really repeated mistakes kind of a thing. So this one. Okay, polytrauma. Polytrauma, which of the following is considered as an adjunct to primary survey? Adjunct to primary survey. Okay, so which of the following is not considered as an adjunct to primary survey? So X-ray PA view. X-ray PA view is not a part. Okay, so this is huge basically. PA view is not a part of the primary survey, but AP view is a part of the primary survey. Okay, so this I really have to go back to the primary survey का notes and see. ठीक है, so primary survey, where is it gone? Trauma. Primary survey. ठीक है. Let's see, spikes of modality. All this that we had, and then you have acute hemothorax, and then you have this, and then you have this. Okay, so primary survey, obviously airway, breathing, circulation. Quickly, where's the X-ray? Interosseous, that's fine. Vascular dissection, venous cut down, all that is absolutely okay. Okay, AP view, I haven't written this anywhere. So, okay, imaging modalities in primary survey. So the most important thing what I have to write down, okay, is AP view is done. View done. Okay, AP view done. Fine. AP view. Okay. Primary survey resuscitation, all this is okay. Jaw thrust, chin lift, disability assessment, exposure. Adjuncts of the primary survey, that's fine. Okay, adjuncts of the primary survey, this is very essential. Okay. मेरे को तो मन कर रहा है इसको कॉपी पेस्ट कर देना चाहिए. I had this somewhere. Anyways, ठीक है. Adjunct to the primary survey. Okay, so देखते हैं. Obviously ECG, cardiac monitoring, pulse oximeter, capnography. Imaging में we do trauma radiograph, that is cervical spine, chest X-ray, pelvis, fast, DPL, CT. Okay, ABG, urine analysis, and all this thing will be there only. I had this. I think I'll copy paste this because this is something that I wasn't aware of, not exactly aware of, but then yeah, I can just later on I can write it down or something like that. इसको पर summarize, I have to summarize this. I'll have to summarize this later on. So इसको अभी के लिए वहाँ पे रख देते हैं. But I'll be summarizing it, otherwise और Google होता जाएगा. So here you have chest X-ray, and you have chest X-ray. You have pelvis, AP, DPL. So diagnostic peritoneal lavage also you do. Fine. And so you do diagnostic peritoneal lavage as well. And you do that even. Okay. ठीक है. So let's see. Next is what is the central line insertion? So 236 and 136. So 36 I got that right. Above the nipple line and lateral, below and lateral to the pectoralis major, but it's posterior to the mid-axillary line. That is the most important thing. और इसको ये bookmark करेंगे because this is really important. इसको बार-बार I'm getting things wrong. So I think this is okay. Chest drain, triangular safety, okay. Chest drain, all this is okay. Includes pleura, sedative anterior, skin incision, all this is okay. Okay. Next is sequentially for renal injuries. So 1, 2, 3, 4, and what did I do? 3, 4 was correct, and 1, 2 is reversed. Why? So 3, 4 is avulsion of pelvic junction and shattered kidney. So first is going to be subcapsular hematoma and then fascia of Gerota. So this is important. Okay, first is going to be subcapsular hematoma and then it's going to be fascia of Gerota. Okay, so this is important, and I think I'll just take a quick peek at किडनी इंजरी मैंने किया भी नहीं है, एब्डोमेन में है, नो आई डोंट हैव एनीथिंग अबाउट किडनी, रेनल इंजरी नथिंग, अच्छा ठीक है कोई नहीं, रेनल इंजरी don't have anything about renal injury, fine, नहीं है, okay, so renal injury, what do you have here? Okay, this is also new, this thing कि you have correct sequence of renal injury, so blunt trauma, contrast and CT, all that is okay, so always it is going to be subcapsular hematoma before fascia of Gerota, ठीक है. So this is the done laceration and lacerating system and all this is okay. Shattered kidney is all shattered. Okay. Okay. So wait a second. Excuse me. Subcapsular hematoma and then you have capsule. Okay. Fine. So triangle of doom. The triangle of doom. This is also a very sad thing. Vast difference. You're continuously making mistakes in this. Okay, vast difference is laterally. Vast difference is the one that is present medially. Okay, and laterally. So vast difference is laterally, and genital band is the genitofemoral nerve, that is okay. And lateral border that is formed by this, and medial border is formed by the ductus deferens, and lateral border is formed by the gonadal vessels, and the genital branch is the genitofemoral nerve, and then you have iliac in this thing. Okay, so I think this is more or less okay. Triangular dome is bounded by all these things, and external iliac veins is going to be these circumflex iliac vessels and femoral nerves. Okay. Now, staples and sutures, you have to avoid this space. Myopectoral orifice is a nauseous this thing, and I think this is already present somewhere, so that is more than enough. And yeah, I think I'm done with most of it. So surgery done, gynae done, surgery done, gynae done. And did I have anything else? Okay, now I'll just do those that I have like really small this thing in. So ortho, let's look at ortho. 5-year-old boy comes to the emergency department after a fallout. After a fall, and then you have this. I thought it's a kid, so it should be green stick fracture. 40% of the people have actually marked green stick fracture, but it's not. Okay, so let's see. What is a Taurus fracture? I have no clue. Okay, any one of you have any clue what is this fracture? Okay, let's see. So the given X-ray is Taurus fracture where compression is on one side and the other side gets buckled. Okay, so you have compression on one side and the other side gets buckled. Fine. Okay, and it is caused due to trabecular compression, axial loading force. Fine, along the long axis of the bone. Most commonly occurs within this, and it is commonly seen in the distal radius. So that's why they're giving you a distal radius and they're giving you something like this, a picture. So you know that there's buckling and then there is something like that. So distal radius and immobilization, splinting for 3 to 4 weeks. That is so. Immobilization splinting is going to take care of the fracture. But the most important thing, I want to see a picture of green stick fracture. So green stick fracture and this. What is the difference? So green stick fracture, you actually have a fracture line, okay, and everything. Here, you just have a bending kind of a thing, okay. So so Marrow actually gave this thing here itself. Good. So green stick fracture is actually seen in the children. Okay, so cortex is actually broken, the other side is intact, and here it's like buckling. Okay, buckle fracture that you get. Okay, it's something like it is like twisted and depressed kind of something like that. So that's what it is. And orthopedics was one wrong, and biochemistry, I'll just check biochemistry is with 3 wrongs. Okay, very sad that vitamins का question I'm getting wrong. अच्छा कोई नहीं, aldolase pyruvate dehydrogenase. अच्छा, quickly let me review biochem. So okay, 15-year-old male, steatorrhea, hemolytic anemia and ataxia. Peripheral blood picture, which vitamin का deficiency? So hemolytic anemia, like I'm very vitamin A. Does anyone even study vitamin A? But whatever it is there. So the clinical vignette shows steatorrhea, that is mainly vitamin E. Vitamin E, A beta lipoproteinemia. So this is something that I have to do. Microsomal, so that's why. Okay, that's why you're having steatorrhea. I think I'll have to see because this is a part that I skipped. Okay, so vitamin E is a part that I actually skipped. Like मेरे पास notes भी नहीं है vitamin E के. So vitamin E is important. No, like just this thing. Okay, let me make an effort to read this. Okay, so steatorrhea, hemolytic anemia, and ataxia, and you have this in the peripheral blood smear, and it shows acanthocytes. Okay, and they are supposed to be okay. So acanthocytes. So you have steatorrhea, hemolytic anemia, peripheral blood smear. Obviously, that was acanthocytes only, and what do you get here? You got steatorrhea, hemolytic anemia, ataxia, and there is peripheral blood smear. Okay, so vitamin E, the black arrow obviously shows aggregates the cells that is supposed to be acanthocytes. Okay, and the most significant association includes A beta lipoproteinemia and severe liver disease. So loss of function mutation, microsomal triglyceride transfer of protein, MTP gene is mutated and all of these are not produced obviously, so that's why they're having steatorrhea. And features of Aberrant anemia is going to be known, none of this is found. Treatment is large amounts of diet will be converted to short chain fatty acids. They don't need chylomicron absorption. Alpha tocopherol is the most biologically active form. Chain breaking antioxidant. Fine. So free radical scavenger. That's why it's supposed to be this thing. So अगर कुछ भी नहीं आए, you just have to think which of the following is the best free radical scavenger. That is vitamin E, and that's why all these species are being formed, because there's some kind of defect in vitamin E. What I'm going to do is first aid. I'm going to search in this. Okay, so let's look for it. Okay, vitamin E. Do they have anything on vitamin E? Okay, so let's see. We have vitamin K. Vitamin K has been asked in NEET. And okay, so here you do have something. Okay, so antioxidant, it protects RBC membranes, free radical damage, hemolytic anemia, acanthocytes, muscle weakness, ataxia. Okay, so they picked up the question from here. So acanthocytes, that's what we had, right? Steatoria, hemolytic anemia, ataxia. So let's see, steatoria. Oh, Mansi, how many hours do I study? Actually, I study. I've recently started streaming all my study sessions. So if you just go back to my channel, you'll just be able to calculate the number of hours I study. But the thing is, actually, I have fixed sessions. Okay, I'll just, I can just show you where to go. Wait a second. Just you can. Okay, so you can go here. Right, and you can go here and you can see all this. I mean, this is all my study hours. Okay, starting from here, like today, which I streamed 10 hours ago. So this, all of this is my study hours. Okay, so I can just send you the link to the calendar blocking video that I did, because this video will basically explain everything about the study block. Okay, so I'm just sending you, here's the link to the video, and that's like how many hours I study basically. So I stream all my study sessions because I'm a big procrastinator. If I close the stream, I'll start reading manga. You probably saw manga links everywhere on my desktop. So yeah, so let's okay, so this question actually, oh my god, they picked this up from first aid to some extent. Actually, no one does vitamin E, right? I mean, who studies vitamin E? Have any of you people studied vitamin E? Any of you people who are watching the stream? So whatever it is, I think we can do the bare minimum, right? The bare minimum means we have to finish whatever is in first aid. And what was that page number? I'll just take it out on my tab, page number 70. So let's see. So here we have, it is obviously tocopherol, whatever, it is an antioxidant. Okay, so the first thing is that it is an antioxidant. Okay, GT here, and GT, I usually use the green highlighter. So let's see, it is an antioxidant. Okay, it's an antioxidant. It protects RBC membranes from free radical damage, hemolytic anemia. So this triad. Okay, hemolytic anemia, acanthocytes, and hemolytic anemia, acanthocytes, and what else did we have? We had demyelination of posterior columns. That's why there is ataxia. Okay, and neurologic presentations may appear similar to vitamin B12. Okay. Okay, so yeah, you can roughly keep it as 10 hours. Roughly 10 hours. Yeah, roughly 10 hours of study. Roughly 10 hours I'm doing. Okay, so let's see. But then I think like 8 to 10 hours maybe. Yeah. So because I study in the morning as well. So let's continue with this. So let's see. Your neurological presentation will be very similar to vitamin B12, but obviously B12 is megaloblastic anemia. Okay, so this is very important. I mean, B12 would be megaloblastic. Okay, so we have exactly these. We had okay, increased risk of enterocolitis. So this is also very important. Enterocolitis in infants. Okay, enterocolitis in infants. Now, that patient was what? That patient was a 15-year-old male, had steatoria as well. So I think I can put in steatoria here, right? Steatoria as well. So steatoria and yeah, and so इसको थोड़ा सा you have to understand this better. And yeah, I think it's absolutely okay. Let's see, which enzyme is involved in the cataract formation in a patient with diabetes? So sorbitol pathway. This is also another thing. Keep avoiding. Acha. Let's get into sorbitol. So uh, sorbitol. Uh, okay. So uronic acid, and this is the polyol pathway. तो इसमें क्या था? To convert glucose to fructose, you have glucose, you have aldolase reductase, which basically converts it to sorbitol. Then sorbitol dehydrogenase converts it to fructose. And in lungs and kidneys, the pathway only occurs till sorbitol. So when you have excess of glucose, all these things are affected. Okay, aldolase reductase has very low affinity towards glucose, so only excess glucose, that is diabetic cataract. Okay, so dulcetol. I think we are in a pretty good position with respect to this. Let's see. So aldolase reductase, cataract formation, take care. Glucose, this is reduced. Obviously, we read that there, and it accumulates, and it is more sensitive to very high amounts. Okay, so that is very important. It is very sensitive to very high amounts, and you have galactokinase, galactose 1 phosphate, uridyl transferase, and you have galactose metabolism. Okay, fine. A biochemist is working on a study of enzyme activation in the fed fast state. He gave a daily dose of insulin to this thing. Which of the following enzymes will respond to his dose? Okay, so insulin. Okay, so this is also this thing mistake. I mean, pyruvate dehydrogenase, obviously this would be active because pyruvate dehydrogenase would be converting things. क्योंकि dephosphorylated state में all of this is active and pyruvate dehydrogenase is dephosphorylated state and insulin works in the fed state. In the dephosphorylated state, and that's where it gets all its this thing from. Like insulin works in the fed state. Insulin has everything to do with the fed state. Okay, like even if I look at the general topics and if I take out this, insulin has everything to do with the fed state. Okay, because you have this hormone regulation part. If I just go back and look at my notes, let's see. So, okay, so gluconeogenesis, you have pyruvate dehydrogenase here because it's the link reaction, so it's important. Yeah, this is what converts pyruvate to acetyl CoA. So, yeah, I think well-fed state, PCA cycle, all this is pretty decent. Okay, so let's check your messages because I'm done with biochem. Okay, and with this, I think I'm done with my GT reviews. I have to do this physio, and this is like just one. As usual, I keep making the same mistake again and again. And this is the aim, this is an aims question. So the V is just that volume. Okay, so yeah, I think I'm done with the GT review. Just itna hi sara karna tha. Medicine and all this I've already done, and tomorrow I'm going to give another GT. Okay, so Mansi. Okay, Mansi. Okay, first aid USMLE. Yeah, I mean, if you see, actually, first aid is, I'm using first aid because I have Google size notes. Okay, you saw my notes, you can at least search in them. Okay, it's a search engine. Okay, so that's why I needed a concise source जहाँ पे I can just put in everything, just the relevant stuff जो नीट में आया, जो एम्स में आया है. So that's why I just write it down in that only. So that's how I'm using first aid, and I'm just using everything in the digital format because I've switched over to digital. Now if you are a if you have if you have like if you are thinking of marking it and stuff like that, and you have the provision of a tablet or a computer or something like that, then go ahead and use the PDF version. And if not, then kahin bhi you can get it from discount. Like if you really want the hard copy, PDF version will also do. Okay, PDF version will do. But if you want to mark it and you're not a digital kind of a person, then you can buy it from वो Indian version खरीदना. I think the Indian version is of a lesser price, and take it for a discount. I mean, देखो अगर कोई क्रिसमस सेल वगैरह आ रहा है कि नहीं. Okay, like for me, I've always been a person, I just look for sales, and the moment the sale comes, I buy. So so you can do that, like that will be a really good way to work out things. And actually the best part about digital, I find the best part about digital is you can search. You can search, मतलब तुमको कोई topic देखना है, you can just search. Okay, so now tomorrow is the GT day. ठीक है, so let's plan out. Oh, you have a laptop. That will also do. Okay, if you can mark, if you want to mark, like if you're going to use it just as a supplement and not as your last, like mine, for me, first aid is like my last go-to revision source. But if you have revisable notes, and if you are that kind of a person, like you're going to note down things in your notes itself, and first aid, you're not going to make it your base or something like that. So just go for the PDF version. Okay, go for the PDF version. ज़्यादा पैसा मत खर्चा करो, ठीक है? So go for the PDF version. That will be more than enough, ठीक है? You look at it. You look at the PDF version and everything, and see whether you like it or not. And you can mark it also over there. Only you can mark it. on the laptop itself, because you are not going to make that your base, right? So if you're not going to make that your base, then it's no use buying the book as such, but it's a nice book. It's a really matlab, I have benefited a lot, means I have benefited a lot in cutting down things. Like when it comes to first aid, it's like I've really benefited a lot by cutting down. Like मेरे को पता है कि बस इतना ही पढ़ना है. Now I'm not going to read vitamin E from biochemistry Marrow. नहीं पढ़ने वाली हूँ. I'll just read this. That's it. Okay, because I mean already Marrow is like too vast. So yeah, okay. So let's see. Mansi, if like one more thing, I actually stream all my study sessions. So usually I try to touch 10 hours a day, but then I can't. Okay, and I try as much as I can. Okay, so you can go ahead and check out all the, like, I actually put my calendar link, like the link to this calendar is there in this stream as well. So you can check out the link to the calendar. Means basically I block all my study time. Okay, and if you click this, you'll get ki I'll be doing one session from 9:15 to 10:20, then take a 10-minute break for 10:30 to 11:30, then take a 10-minute break, like this kid. But sometimes if I'm too busy in that particular session, I forget that the break has started. Okay, so that happened to me today in the morning. So wo bhi, that also can happen at times, and I usually send out forest sessions. So the link that I have sent, it's basically all the planning that I did and things like that. So this is like a prototype. Even anyone can make this. You just need to repeat this. Okay, and tomorrow I'm gonna give a GT. So I'll just write here GT Sunday. Okay. I don't think I may stream it. I don't know whether, because that is like more of a Rajat sir has a mentorship program, so I'm a part of that, and he'll be giving a GT like for the mentorship program, and I'll be reviewing my GT tomorrow itself. Okay, so and अगर हो सके तो I'll be doing critical care medicine if time permits. Now another thing is I need to change this, 2 to 4 p.m. sessions. How do I go about this? 2 to 4 p.m. session. I think we should keep 45-minute sessions, or 35-minute sessions, because afternoon you actually feel very sleepy. So let me calculate and make a change today itself. Okay, so first I'll be trying this 25-minute session, 35-minute session, sorry. Let's say no breaks. No, we will take a break here. I'm changing this. इसको change कर देते हैं. Let me change this to make it. I'll just make it 2:30. 2 p.m. 2 to 2:35 p.m. 35 p.m. and then break. We can make a 10-minute break, and then we do a 2:40 to 3:40 to 3:40 p.m. Okay, I think that should be enough, and let's end the stream. All of the following events. This and all of the following events. Fine. Thank you everyone for listening to me ramble and babble and do all sorts of things. So let's stop the stream, and good night. Good night, people. Good night. Okay, so let's see.